I forgot to bring my agenda, so I don't know if they had.
I'm starting the recording now.
in this one.
There wasn't.
Okay.
Yeah.
Okay, good morning. I'd like to welcome everyone here and thank you for joining the breakout session number 4, Understanding Literacy, Increasing One's Ability to Flourish. Before we get started, I want to remind everyone that we're really looking forward to your participation. So during the course of the presentation, if you want to ask questions, please put them in the chat. We'll probably have a point at the end where you can ask questions as well. It's also available for CEUs. There is a questionnaire, an evaluation that was emailed, and we ask you to go ahead and fill that out. That is also part of the CEU process. So this morning, I would like to introduce our presenters, Beth Pace and Mona Huff from the Traeger Institute, as well as Joanna Mackens. Beth and Joanna, like myself, are student interns at Traeger. And I believe they want to go ahead and start the presentation off with a short video. And after that, they're going to just take over. Thank you very much.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule.
One capsule. I don't know this is. Twice daily.
Okay. So how would you take this?
When I see it's not on, I tell you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension and I've been taking care of that for a long time.
Hypered.
Mm-hmm.
Hypered.
Like you're hyper?
Mm-hmm.
What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
Being,
Okay. But you know you have high blood pressure.
Mm-hmm.
Okay. But hypertension doesn't mean the same to you.
Mm-hmm.
So if I ask you if you have hypertension, you're going to just think I think you're jumping around on a chair or something like that. Something different.
Just being hypered,
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension to us is the same thing.
The same thing.
Yeah.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. And this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office and mostly, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, how are you feeling since your hysterectomy? Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body and I didn't know it?
Okay.
I'm gonna get the PowerPoint pulled up real quick.
As Beth is getting the PowerPoint, I just would like to give you a moment to kind of absorb all of that. I know the first time that I saw it, it really affected me to know without a shadow of a doubt that many people that come into our clinics and our hospitals are experiencing exactly what these folks said. My name is Mona Huff, and I am a community health education coordinator here at the Traeger Institute. And I have been blessed to work with Beth and Joanna, who are students. And I put a plea out that I wanted some help to put a health literacy toolkit together. And they were part of a team that helped do that. And you're going to hear more from them in a few moments. But first, I just want to share a little bit of my history with a literacy program that I worked back in the early 90s in Henry County. And I had a student who came to me who could not read. And as soon as she got there, she would fall asleep. And, you know, I hate to think that I'm that boring that somebody's going to fall asleep as soon as I start talking to them. And so we just started talking a little bit about her daily life and the fact that she was on multiple medications. And so I just asked her if she would bring them in and that we would look at them and I could see what she was taking. I found that she was taking some medications that were meant for night. And what she had done is what the one person said. She had taken all of her pills in the morning because she wasn't sure when to take them. And then she wanted to make sure that she didn't forget them. And so she was taking a handful of pills with just a cup of coffee in the morning and coming to the GED-literacy program. So I asked her if we could talk to her pharmacist and help her pharmacist understand that she needed a little bit of help taking her medication. And she agreed, and we talked to him. And what he did is he color-coded her medications, and he fixed them so that she would know what to take in the morning by making the label yellow, and then what to take at night by making the label blue. So in this next slide, what I want you to do is I want you to look at that. And I want you to read that to me. Who will volunteer to read? Come on now, you can read that. Look at that. Can you just imagine how someone must feel when they're told these kind of things? Can you imagine the frustration of one who cannot read being asked to read in the public or being asked to read some papers and sign it? Well, in case you're wondering what that does say, and you don't happen to read Russian, it says, I want to be healthy. And that's what we want for our patients, our clients, our family members. So we are going to talk today how we can help them be able to speak up for themselves, and then also what we as providers need to do to recognize when one can't read. Joanna's going to talk to us a little bit now, so I'm going to turn it over to her, and she will introduce herself and talk about some slides.
Hi, everybody. My name is Joanna Mackens, and I'm a student in the master's program for social work at the University of Louisville, and I'm an intern at the Traeger Institute. So today, for our objectives for this presentation, will be to understand the prevalence and implication of low health literacy rates, understand the limited health literacy and how it translates into poor health outcomes, and that it may be the single best predictor of health status, provide tools and resources to healthcare providers to better understand their role in improving health literacy, and provide resources and communication that meets the needs of all patients regardless of their health literacy level. Health literacy is officially defined by the U.S. Department of Health and Human Services as the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions. In simpler terms, not everyone has the same literacy in life, same level of literacy in life. If someone does not have an adequate ability to read or comprehend written materials or understand certain vocabulary, or if they're not familiar with certain medical terms, or how their bodies work, or if they have an inability to interpret statistics or evaluate risks and benefits. All of this affects their ability to understand and manage their own health care, and that affects their health and well-being. Low health literacy is very prevalent in our society, and nearly 9 out of 10 adults have difficulty using everyday health information. Despite its importance, this is an issue that has gone unaddressed and unrecognized. So the at-risk population include the elderly, adults with vision or hearing loss, adults with any type of disability, difficulty, or illness, those with limited education, those with lower income, non-native speakers of English, any racial or ethnic group, recent refugees or immigrants, and older adults in rural communities. So that's quite a few at-risk populations there. It's important for us to not assume that the patient is comprehending everything the doctor or nurse is telling them or the written information they are provided with. So I have personal experience with this. My husband was a native French speaker. He was from Belgium, and he had lived here for 25 years, and his English was really good. However, when he was diagnosed with kidney cancer in 2019, his English just wasn't good enough to comprehend everything that was conveyed to him about his diagnosis and the care he needed. And also compounding the problem of an individual speaking English as a second language, or really if you're in any of these at-risk populations. As in my husband's case, when someone is presented with a life-threatening diagnosis, the anxiety that enters the equation also lowers the literacy for the patient. So health professionals should never assume that their patients comprehend what they are saying, even if they assume that individual has a higher level of literacy. So my husband was lucky because he had me to take notes and basically translate everything for him. And we did that. We went so far as to make recordings of our doctor's appointments and review them after. But not everyone has someone to do that for them. So we'll see later in the presentation how low health literacy can affect a patient in extremely detrimental ways. Cultural, social, and family influences shape attitudes and beliefs, and therefore influence health literacy. Social determinants of health are well documented regarding the conditions over which the individual has little or no control, but that affect his or her ability to participate fully in a health literate society. Families and communities consist of people with multiple cultural backgrounds and experiences. who cannot be put in rigid boxes by using racial and ethnic labels that are often resented and misleading. Individuals, families, and communities have belief systems, religious and cultural values, and group identities that serve as powerful filters through which information is received and processed. These concepts of cultural processes and lived identities replace more traditional concepts and present many challenges to healthcare systems and professionals. Implicit bias is an unconscious favoritism or a prejudice against people of a particular ethnicity, gender, or social group. We all have implicit biases, and although we are generally not aware of them, they can influence our speech and action toward others. Implicit bias is hidden and very difficult to recognize in yourself, but we can assume that we all hold these implicit biases because they are a result of subconscious conditioning that's in our culture. Implicit and explicit bias contribute to disparities in our healthcare system here in the United States. Explicit or implicit biases may mean that a health professional limits their shared decision-making with the client, or perhaps does not fully explain medical concepts or the intricacies of a patient's diagnosis and care, because their bias may tell them that the patient does not have the level of literacy to fully comprehend it anyway. This might not even be a conscious decision on the part of the healthcare practitioner. Therefore, the existence of implicit bias is something that we all need to be aware of and conscious of in our words and actions at all times.
Now we want to talk about some considerations for low health literacy. One is frequently missed appointments. Don't assume that they are simply not showing up because they don't want to. Perhaps they do not understand calendaring well. Incomplete patient restoration forms. Again, a lot of times people will think that they're just being lazy or not reading it well, but they're not understanding it more than likely. You're going to need to move that a little bit. Non-compliance with medication. Oh my goodness, how I hate that word non-compliant. Let's try to find out why. There's a multitude of reasons. Not only not understanding what they're supposed to be taking, but often a person cannot afford the medication or does not have transportation to get to the medication. Unable to name medications,
Or
explain purpose or
of why you're taking it.
Or why they're taking it. We got something over it and I'm having a hard time seeing it. That's one of the ways that we can really check with a person is just ask them to show us their medications and to tell us what it is and why they're taking it. And if they don't understand, then more than likely that is the issue. Identify pills by looking at them and not looking at the labeling is another way. Unable to give coherent sequential health history. There's lots of reasons for that. Sometimes they just can't remember everything that's happened. And if they don't have an organized way of recording those types of things, it's going to sound very shaky for the healthcare provider, and they should use that as a clue. They can ask few or no questions. Sometimes a person who can't read and doesn't understand will just shut down and not say much of anything. Or they may be the other way around and ask a multitude of questions. And sometimes the questions may not even make good sense with what's going on. Doesn't follow through on tests or referrals. And this is really one that we don't think about, but it's a big red flag. I forgot, I lost, I broke my glasses. Or simply my eyes are tired. These are all considerations that should give us a red flag and help us to ask some more questions to find out exactly where our client may be.
And what I hear too, just in that list, it's really what we need to be aware of is changing our focus to more of a positive perspective. We want to be thinking the best of people and getting curious when some of these things happen, rather than jumping to conclusions that may or may not be the answer, but to meet people where they are. So my name is Beth Pace, and I am also a social work student at the University of Louisville and an intern at Traeger. And so I'm going to take over here by just kind of explaining a few simple assessments that can be used in a clinical setting. There are screening tools that can kind of quickly help you identify if someone may be struggling with limited health literacy. So here's just a list of a few that we are aware of, and I'm going to show you a little bit about them in the next few slides. But these are tools that can be quickly used. We obviously want to make people feel comfortable. We don't want to make anyone feel put on the spot. And so having adequate training in how to administer these tools is really important. But we can, and we also want to kind of always be putting the focus back on ourselves as the practitioner, the responsibility, by saying something like, I want to make sure I'm explaining things in a way that makes it easier for you to understand, and this will help me know how to do that. Kind of those types of kind of introductions with these screening tools. So you may or may not be able to read all this, and that's okay. I just wanted to show it to you. This one is called the Newest Vital Sign, and it's a really helpful tool because a patient's ability to read and analyze nutrition labels requires the same skills that are needed to understand and follow a provider's medical instructions. And so I'm just going to kind of briefly explain how to use it. There's a lot more information on their website, like detailed instructions on how to administer it and how to score it, but we'll just kind of overview quickly. So a nurse or trained staff member can administer this test just when other vital signs are taken, so kind of making it more of a routine part of the visit. Rather than singling anyone out or making someone feel uncomfortable. It's just part of the routine visit. You could say something like, we're asking our patients to help us understand how well patients can understand the medical information that doctors give them. Would you be willing to help us by looking at some health information and then answering a few questions about it? And your answers will help our doctors learn how to provide medical information in ways that patients will understand. It'll only take a few minutes. So then if a patient agrees, you would just give them the nutrition label that's there on the left, and they can keep that throughout the whole time and reference it as you're asking the questions. And then you just start with these questions on the right side. And after, you don't really, there's no time limit or anything, but after, the whole thing really should only take 3 minutes or so. So if a person's really struggling to answer the first couple questions, you might just kind of conclude that they are dealing with low or limited health literacy, and you don't have to force the rest of it. But anyway, you just ask those questions and see if they're able to take the nutrition information and kind of translate it into a real life question. This one is called the Rapid Assessment of Adult Literacy in Medicine, and the instructions are right there. It's kind of a script that it gives you, where you would say, providers often use words that patients don't understand, and we're looking at those words that doctors often use to try to improve communication. And so you would just ask them to read those words and see if they're able to do it. Super simple. This one is a little bit more about understanding and association. And so you would have a card with like where you see kidney, urine, and fever. It would have kidney on the top and then urine and fever underneath. And you would just ask the person to read the top word and then say which of the words underneath are most similar to the first word, to kind of see if they have an understanding of what those words mean. Before we go on, like the most important thing is not this assessment. These are just tools, but what we do with the results is the more important piece. So when we realize that someone has limited health literacy, we have to be willing to adapt our communication to meet their needs and make sure they understand. So there's like a curiosity and a creativity that's important there, to not just keep going through the motions, maybe like we typically do, but to be willing to slow down and communicate in different ways, which we're going to talk a little bit more about later. But we've also created and collected some simple, helpful tools with ideas on how to do that in our health literacy toolkit, and we'll talk a little bit more about that shortly.
Some tips for effective communication are to avoid, overly complex medical jargon, and make sure that patients understand their diagnosis before they leave the room, and ensure that they understand the care of their condition. So at this point, we would like to open up to a little general discussion. Does anybody have any personal stories about health literacy that you would like to share?
Well, Joanna, I can share one about a client I had one time that actually was in a diabetes self-management class that I was doing. And one of the questions was, do you understand what a fasting blood sugar is? And did you take your blood sugar this morning? And so, and what was it, if you feel comfortable sharing it? So a few people shared, and this one gentleman, he shared that he had taken his, and his was real close to 400, which if you're not familiar with what a fasting blood sugar should be, there's little variances according to one's age and history, but usually we say anywhere from 70 to 100 or 80 to 120. And so for someone to say they have a blood sugar of almost 400, that's a little frightening. So I just asked him if he had talked to his doctor about that. And he said, yeah, my doctor said I'm doing really good. So, you know, you have to be careful when you're in that type of situation, that it doesn't sound like you're talking down a doctor. And so I just went on with the class. And then a little bit later, he shares that when he was first diagnosed, that his blood sugars was running 600 and above. And so I said to him, do you think that maybe when it got down to this other, that he was saying you were doing good at that time, does he really understand right now that your blood sugar is that high? And he says, well, I don't know. And so I encouraged him to get a hold of the doctor's office and to make an appointment, which he did. And when he came back the next week for class, he thanked me and said that the doctor was horrified that he thought that was good, because really what he was saying to him is you are doing good, but he thought he was good and didn't have to worry about his diabetes blood sugar number any longer. So that's my story. Someone else share one.
And I think that really illustrates the kind of, you know, danger there is too, and just not understanding these things. And I mean, I feel like that's kind of a easy mistake for anybody to make too, you know, that, you know, just a little misinterpretation of your doctor's words and you think you're doing fine, but really you're in danger physically. Does anybody else have anything? Okay, I guess we can continue on.
So why should we care about health literacy? We've kind of talked about the fact that it's prevalent and lots of people deal with it, but what are the implications for ourselves, for our loved ones, for the people that we interact with professionally? Maybe some of us have patients that we work with. How would you answer that question? We would love to hear from some of you, maybe what ideas you have about the impact of low or limited health literacy. If anyone's willing to unmute and share. No takers. That's all right. So here are just a few of the implications for patients with low health literacy. They are less likely to follow treatment plans, have higher mortality rates, are less likely to understand their insurance plan and get prevention treatments, are more likely to visit an emergency room, have more hospital stays, and the impact is poor health outcomes in general. So I had an experience with a patient here at the clinic who needed hearing aids and just didn't, and I don't even know that this is a health literacy issue as much as just a understanding of the insurance plan and the way that that works. So we were able to get on the phone and find out what her coverage was and find out where she could go to get the hearing aids that she needed. She didn't even know that that would be covered, so she thought that was out of reach for her. So we definitely see people who don't get the care and treatment that they need because of not maybe having a full understanding of even their insurance plan. There was an article in Social Science and Medicine. The title was Effects of Health Literacy on Health Status and Health Service Utilization Amongst the Elderly, kind of a wordy title. But it suggested that improving health literacy may be the most effective strategy for improving health status and lowering hospitalization and emergency room use for elderly patients. So one of the biggest things that can really make a huge impact on outcomes. The researchers emphasize the need for designing more reader-friendly media with simple illustrations and culturally sensitive examples in order to make healthcare systems more accessible for those with lower rates of health literacy. And then there's another study, a little bit older one in 2007 from Northwestern University's Feinberg School of Medicine. And it showed that older people with inadequate health literacy had a 50% higher mortality rate over 5 years than people with adequate reading skills. That's just remarkable, a 50% higher mortality rate. And we've come to understand since then, I think even a little bit more about health literacy, that it's not just connected to reading levels, but we've talked about some of the other factors that can impact a person's ability to understand their health information. But this study just highlights how important this concept is, that it really can be a matter of life and death.
So what can we do? Well, first of all, we want to empower our clients and their caregivers to communicate effectively with their healthcare providers. And we have to help them know how to do that and teach them, invite them to ask questions and help them know how to write down a few key words that will help them to remember their question. And some of those questions may include, what is my main problem? What do I need to do? If they say, watch what you eat and exercise, help our patients to know that they can say, please tell me what that means, or please have someone talk to me about that. And so I would just say, for them to be able to say, why is it important for me to do what you're suggesting? You know, that why question sometimes will make it kind of mold in our brain. And if we understand why it's important not to eat a lot of salt with high blood pressure in very simple terms, then that may help us to start watching our salt intake better, rather than just saying, reduce your salt, or they'll even say sodium. And sometimes the patient doesn't know what that is. I like to teach them the teach back method to engage in his visits as a visit ends. And so in case you don't know what the teach back model is, what we say at the end as a provider, we can say, well, can you kind of tell me what happened today, that what you're going to take from here and some of the changes you're going to make? But if the provider doesn't do that, then I give permission to the client for them to be able to say to the doctor, the healthcare worker, if I'm sharing this with my spouse or my mother or whomever, here's what I'm going to say that I learned today. And I practice that myself. And I'm someone that has worked in the healthcare system from one way or another since 1965. And I cannot tell you how many times I got it wrong. So help our clients know that it's okay to say, here's what I heard, here's what I'm going to change, so that the healthcare provider can agree with them or can help them see the difference. And I would say if you are a healthcare provider, a social worker, someone that's interacting even with a family member and trying to help them, practice this teach back method yourself so it becomes kind of second nature to them. At the end of your session, use a teach back action to make sure that they understood what you were trying to share with them that day. And if they don't understand it and there's correction, start that correction with, it's very obvious that I did not do a good job of explaining, which was shown in that video by that doctor, because they already feel like maybe they're not smart enough. Maybe, I mean, you saw that one lady kept saying, how stupid of me. And unfortunately, a lot of people have that description of themselves. So you take the responsibility for making sure that they understood what you were sharing with them on that visit. Okay, am I supposed to do this one too? Okay. Effective strategies for action plans. Okay, so we want to be sensitive to the feelings of shame for not understanding. That was basically what I was just saying. We want to communicate clearly. And within this toolkit, there is going to be a glossary. And we're hoping that our healthcare providers will look at that and that it will become second nature for them to use these words rather than the traditional medical words that can be confusing to people. Always when you're working with someone, just share 1 or 2 points at a time. We have a tendency to give them the whole story and they're not ready for it. So let's just share with them what they're ready for and what they can understand. And we've said it before, use jargon-free communication, use pictures to clarify concepts, and show them when possible. And what I mean by that, if you're telling them a procedure, actually go through that procedure with them. I will use an example of taking a blood pressure. You could tell me how to take a blood pressure until the cows come home. But until I actually do a blood pressure and have been affirmed by someone that I'm doing it correctly, I'm not going to be comfortable taking that blood pressure. If you're teaching someone how to test their blood sugar, again, you can't do it for them. You can't touch them unless, of course, you are a medical person working from that tool. But as a community worker, as a social worker, you still should know how to do these things and be able to describe it to them and then ask them to do it in front of you so that they have the assurance that they really know how to do it. All of our materials that we give to folks should be at a 5th grade level or lower. And most things that goes out of physicians' offices are at a 12th grade level. We need to use a font size of at least 14, and my eyes are becoming very, very strained and very, very bad. I'm about ready to change that to a 16. And do not use all caps. Some people think that helps see better, but it does not for the aging eyes. And do not use fancy styles. If you are one that's doing graphics, Google proper graphics, proper flyers, proper language for those that are aging, proper colors. Some colors cannot be seen with certain eye problems. And confirm understanding, again, with that teach back way. Does anyone have any questions or any comments over any of this?
There are a couple comments in the chat. So Carla said, I think it is difficult for a patient to talk to a medical personnel such as a nurse practitioner who does not take the time to talk to the patient to make sure that they understand what is being conveyed to them concerning medication or information on their condition. We can only continue to encourage them to speak up, and I do this with the clients I work with. And Jennifer said, I think it is also hard when they're only getting a 20-minute visit with their provider. And we need to make sure that we are meeting the needs of the patient versus hitting our 20-minute time limit, which I say definitely, because in my personal experience, especially when you're dealing with someone who has a life-threatening condition, it can be very also just disheartening to have, you're in the appointment for a very short amount of time. A lot of stuff gets thrown at you. The doctor seems hurried and they're out in a few minutes and you don't have an opportunity to ask questions.
Yes, and that's another thing that we can use as a teaching tool. If a person, when they're making their appointment, they can ask for a longer appointment and tell them why. Also, if they don't feel like things have been answered adequately, they can say to the healthcare provider, I understand that you're on a schedule, but I really have some more questions and some more concerns. May I come back in a few days, or is there someone here who can help me understand? And obviously, that takes some courage for someone to be able to speak out like that. But that's our job, is to help empower and help them know that. Also, more and more practices are beginning to have some auxiliary help there. And I hope that we see that increased over the years with having a social worker on staff, with having a community health worker on staff, a health navigator, whatever it may be, so that when the doctor absolutely cannot spend more time, that there's someone readily available that can. Now, one of the things with our toolkit is that we're hoping that we can share some simple teaching tools that someone can help a client go through. My guess is that that will not be the healthcare provider themselves often. Occasionally it may be, but that there needs to be someone that is able to spend that time, even if another appointment needs to be made. So again, help our people know that they can ask for more.
I think Carla also made a really good point about how many people are hesitant to or don't have the confidence to put those questions out there and to say, oh, I need more time, or I have more questions. So it's this tension of we want to empower patients and we also want to take responsibility. And so in whatever setting we all find ourselves in, we just need to keep pushing forward to try to make the environment more conducive for that kind of thing and make that the norm. But I definitely agree, like that's just not everyone has the same comfort level with that sort of thing. So we want to be making it an environment where that is welcomed.
Yes.
And it doesn't happen overnight.
Right. And I've been fortunate enough that here at Traeger Institute, they have allowed me to actually do this training with our healthcare providers. And it has been done from the Dr. Furman, who is our executive director of the medical services. I don't think I'm saying her title just right, but that's what she is. Who in fact was one of the people who asked me to put this together, to the person who greets them when they first walk in. This is for everyone. It's not just for the healthcare providers, but it starts when the person first walks in, and if they are felt valued, and if they are respected, and if it's pretty obvious that if you give them some paperwork that they're having difficulty with it, that someone can discreetly come by their side and help them.
Or even just anticipating that from the beginning and just saying, here's some paperwork. Can I get anybody to help you fill that out? Or, just even making that assumption that we're here to help if help is needed, rather than like waiting for somebody to be struggling.
Yeah, and a lot of times the help that is needed may be a visual, especially if we're working with aging people. I've been to the doctor recently, and when they handed me the paperwork, I just simply said, I cannot read this. I have vision problems. And she says, I'll be over to help you in a moment. And, there's a time that may have been harder on me to do that, but, unfortunately, I was very quick to say I had vision problems. I didn't want to say I couldn't read. And it's a shame that we've put that type of thought into society, that someone is looked down upon that can't read. We don't know their story. So let's be careful with that.
There are a couple more comments. James said, not to disparage physicians, I have found that nurses and nurse practitioners have better people skills and do a better job with psychoeducation.
Yes.
And also Sarah says, I am not a health provider, but I work with a local food bank, and we are wanting to survey seniors in our community about food insecurity. What advice do you have about surveying seniors in an inclusive way? We have done some surveys verbally and in small groups, but are wanting to increase our reach.
Yeah, that's going to probably be difficult to increase the reach, because many of our folks that you're wanting to survey are probably not going to go to your website and find a survey. My guess is that probably collaboration would be one good way. And I do know that you do have Health RX with several of the University of Louisville doctor's offices, ours being one of them, and perhaps even trying to figure out some ways to do it within that program may help. And then the different community health fairs and those kind of things may be one way to get some surveys out. Do anyone else have some suggestions for Sarah?
I know that there's the Age-Friendly Louisville initiative too, where they've kind of focused on different areas of impact, I guess, to make Louisville a more age-friendly community. And so part of that is getting feedback from people in the community. So that might be an organization or a group to kind of connect with to see what's worked for them, what kind of information they've been able to collect.
Yes, they may have some surveys on that very thing. Of course, they would be a few years old, because when we first started it, it was pre-COVID, and we did a lot of surveys. And I wasn't an actual part of the survey giving, but I kept hearing what was going on. So that would be a good organization to get a hold of. Also, KIPTA would be a good organization, because they are responsible for a lot of food in our seniors in our counties. And they may have some information already put together for you.
Which we have somebody from there on this call, I believe, if you guys want to connect. Was there anything else in the chat, Joanna?
No, that's it.
Okay.
Was I supposed to talk about that?
It's okay. So I was just going to go ahead and show you guys a little bit about what we've been working on with this health literacy toolkit. We've kind of created a library of resources to help address the issue of limited health literacy for patients and for providers. So it's a twofold concept, where there's some resources directed towards providers and then others that are more focused specifically for patients. For providers, we have created and collected. So we're not trying to reinvent the wheel. Some things we've created ourselves, and some things that are already out there and good quality, we've just kind of collected into this library. But clear written materials explaining the prevalence of limited health literacy. I know Mona talked about at one point, somebody mentioned, oh yeah, we have a training or a book or something about health literacy for the clinic. And it was like a volume, like hundreds of pages that no one's going to take the time to like read through and learn. So we've tried to make it really brief and to the point, because this isn't, I mean, it's complex in that there's a lot to learn about the implications if you're really going to dig in and research it, but it's really not a super complex issue to start taking steps towards improvement. So simple is impactful, is what I'm trying to say. We've included helpful instructions on improving communication. So even just say this instead of that type encouragement. We want to make it easy to access the library of resources for patients. So, and this is still in development. It doesn't have a home yet. Right now its home is on my desktop, but it will be somewhere where the physicians and anyone in the clinic has access to collect, like to print off resources for patients that they think would be helpful. And then, like Mona mentioned, training for all staff. So we want everyone from the first front desk person to the person checking them out, to the social worker that may come in and check on them, to the providers, to be mindful and sensitive to the ways that we're communicating. Our words really matter, and the word choices matter, and the way we approach people matters. So for patients, the toolkit includes tools for empowering them to approach their healthcare provider. So we have I think it's the Institute for Aging has on their website like printables that you can print off before appointments with questions or medication lists. And so not every patient knows about that or has access to a computer or the internet. So we've kind of collected that in this place so that we can provide it for patients ahead of time. We've created infographics focused on specific diagnoses, conditions, or topics. So really simple kind of pictures and bullet points to be like almost like something you could stick on your fridge versus like the pages and pages of a printout after an appointment, something more simple that can be used for reference. I mentioned the worksheets, and then a glossary of terms. So for somebody who's curious and wants to know what all the medical jargon does mean, Joanna created a glossary of terms that kind of goes through typical medical terms and explains them in a really simple, easy way to understand. It's at or below a 5th grade reading level. So this is I'm only this just to kind of give you an example of some of the things that we have collected. And do you guys think I should share more than just what's on this?
Yeah,
anyway,
go ahead, you got your kids.
So this is one document that the Kentucky Hospital Association put together about health literacy, and it's for just how to communicate better so your patients can understand. And a lot of what we've just discussed is in here, and it's kind of like a 1-page folded front and back little brochure. And so it's a simple thing that providers can see about little changes they can make to be more sensitive. This is an example of some of the infographics that we've created. So this is like the front and the back of one about high blood pressure. Just very brief, like what are some lifestyle things that you can do to improve your or address your high blood pressure. And then on the back, we've connected it with the wellness services that we offer here at the clinic to kind of provide that next step. These can be used to highlight main points or jog memory at home. And it's even better if we are giving this to someone to be able to like talk through it with them after their appointment and connect those dots. Because we don't want to just be throwing information at people without connecting it, like Mona said, back to the why is this important and how's it going to impact me. So I'm actually going to stop sharing for a second and just share something else real quickly. And like I said, this is still still in development, so this is not how things will look in the end, but so we have these infographics for congestive heart failure, depression, high blood pressure, osteoporosis, even like healthy sleep habits and nutrition that can give people just a snapshot, like we said, of things they can do for healthier living and to address health conditions. We also have folders for different diagnoses that we've collected resources. For the providers, we have an infographic that's kind of even a simpler version of that, that document I showed you. And then the health literacy screening tools are in there. Then for patients, some different worksheets that might be helpful to collect the information that they want to take to the doctor or take notes at their appointments, that kind of thing.
Carla has a question. Sorry. Carla has a question. She's asking, do you have the information in different languages for those that do not speak English?
We do not yet. Hopefully in time, we will be able to do at least some Spanish, but right now we're just really struggling to get things done in English. We always are looking for Spanish interpreters. I know that we have 1 or 2 students that are going to be coming that speak Spanish, but at this time we do not. But that's a goal.
Yeah, that's a great question. And it kind of highlights the fact that we see this toolkit as sort of an evolving tool. And so it's something that we have started, but that we're not finishing. We're just kind of passing the baton to hopefully have people come behind us that can keep the ball rolling and keep producing and collecting tools and resources that are going to be helpful. So we're always going to be learning, realizing something that we missed or more detail that needs to go into something, or so we want to be flexible with that and keep growing it and seeing it change over time. So let me go back to the PowerPoint. So that's not. Sorry, hold on one second. Oh, that is it. Okay, sorry about that. So we'd like to just kind of end in closing by hearing from you guys what's your biggest takeaway from today. We don't have to go in order. If any of these questions kind of spark something in your mind, we'd love to hear from you. How would you determine if your client, patient, or family member have health literacy issues? And then maybe ideas that you have about creating an action plan to address the situation that maybe comes to mind. If anybody be willing to share. I'm going to stop sharing so we can maybe see everybody. In the chat, or you're able to unmute yourself and share if anything has come to mind. I will say one thing that just in the last few months of having this information in front of me a lot and kind of being bombarded with having to think about this topic and about how to better understand. I've just thought about my own family, and my parents are getting older, and like the need to like make it a priority to show up and be that second set of ears at appointments. Because it can get, especially if there's more serious things going on, like Joanna mentioned earlier, like the ability to retain and comprehend information when you're in a really stressful, scary situation just kind of goes out the window. And so it's reminded me just of the importance of showing up for people in my life in that way, and making sure that if I'm in that situation, I'm inviting people into that with me. Carla said, I think the toolkit you're developing is a great idea. I've been given some helpful tips from this session. Great. Thank you.
I'm glad to hear that. Thank you.
And then Jennifer said, my biggest takeaway would be do not assume. Yeah, this means do not assume your patient understands what's being told them. Also, as a social worker, we should always advocate for our patients to make sure they're getting the best quality of care possible.
Yes, thank you for that.
Mm-hmm. Yeah, that's a good rule of thumb in all relationships. Do not assume, just assume the best and try to meet people where they are and be an advocate. Jennifer's really good at that. Thank you for sharing. So we appreciate you guys being here so much. Oh, Beth Morgan, she said, we don't have the ability to unmute. Oh, okay. I thought they said you would. So I misunderstood that probably. In assessing clients for home delivered meals service, one of our questions we ask is whether clients have difficulty with reading and writing, and it can elicit an angry response, which can be indicative of a client's inability to read.
Yeah, and that's not a good question. You need to ask questions around that, like have them show you something and you can do your own determination, because not many of us are going to want to say, no, I cannot read, or no, I cannot write. Society has made that shameful.
Yeah, she said we'll often remind clients that we're trying to determine if they can read the instructions on reheating meals.
Mm-hmm.
Yeah.
Mm-hmm. Yeah.
Okay. That is a long screening. She said it's 135 questions that they do over the phone.
Oh, wow.
That is a lot.
Yes, it certainly is. Yeah. So if it's being done over the phone, that keeps a lot of that personal contact relationship and being able to see how they're reacting to paperwork, because sometimes just the reaction is going to tell you an awful lot.
Have you found, Beth, she said agreed. Have you found ways to approach some of those questions and maybe help people, put their guard down a little bit? I guess we're about out of time, but I'll give her a second. Yeah, she said I often change my verbiage.
Yes.
Yeah,
Yes.
for sure.
Yeah. Yeah. And one of the things I used to do when we were doing the face-to-face on our long assessment, and I would just simply say, this is going to seem like it's really very long, but let me assure you that every question has a purpose behind it, so we can figure out ways that we can help you better. As long as they're wanting to know, we're wanting to help them better.
Mm-hmm.
A lot of times that will help.
Yeah.
Well, again, we thank you for joining us. Can you read that out?
Yeah. She said, Ms. Mona, I'm not sure that you know this, but I went to an info session on farmers markets in this area, and they gave a SNAP card for older adults who need fresh fruits and vegetables. That's cool.
Oh, great.
Yeah.
Yes. Is that for Jefferson County only or others?
I think we're about to get kicked off. One last thing I wanted to mention, if any of you are interested in having access to the toolkit, once it's completed, you can leave your email in the chat and we can follow up with a way to connect with that information.
And if something happens and we can't get the chat, I think most of you know how to get a hold of me. Sarah, your people at Dare to Care have my email for sure.
And I have Beth Mackens, but I'll write down your email too.
Mm-hmm.
Okay, and also before we go, obviously we want to thank everybody for coming today, but I also want to remind you that we do appreciate your feedback, and there is that that evaluation that you should have received the email. The subject line should say OAC 2023 post-session evaluation link, April 15th through 18th. And if you want CEUs, evaluation is the first step to get that started. So thanks a lot, guys. Really appreciate it.
Thank you.
Thank you all for coming.
Mm-hmm. Thank you. Can you go back to the lobby and we see the agenda, or are you just on for this part?